which can float, but it cannot float against the current, are called planktonic type of cells. This is on the left. These planktonic type cells are usually which are floating, so it floats along the stream. It cannot go against the stream. It cannot coagulate. It cannot accumulate. It's a free cell. So once the cells are free in the saliva, it sticks to the biofilm and it ultimately attaches and it ultimately forms a very small colony. Then it forms a larger colony. It secretes the EPS and finally a total biofilm is formed. So on the right is a picture of a biofilm. So once the biofilm is formed, the biofilm takes about 4 to 9 days to mature. Once it gets matured, it can stay in a state of maturity or it can go on discharging cells, which is called as dispersion. So dispersal of cell is a very important factor for a biofilm. So once the cells are dispersed, it comes again to a free floating planktonic cell and it comes to an attachment, comes to a microcolony, and the whole cycle is again followed. So it starts, when the biofilm starts or the dental plaque starts, it starts with a very simple gram-positive streptococcus containing environment. But if you allow it to accumulate, if you allow it to get matured within 4 to 9 days, then it will ultimately turn into a gram-negative anaerobic mixture. So how a simple streptococcus is attached to a biofilm and it helps other gram-negative organisms to come into it, accumulate, ultimately help in dispersal. This process is done by a process called quorum sensing. This quorum sensing is absolutely new. It was known say about 50 years back, but how this quorum sensing is done is hardly known about for 2 to 3 years back. Quorum sensing is basically a cell talking. One cell can talk with the other. It can talk with a similar kind of a cell. It can also talk with a dissimilar kind of a cell. It can talk with the substrate. It can talk with the EPS. It can talk with even non-biological objects which are floating in the biofilm. So how will it talk? If you take a food substance and put it in the mouth, it goes into the saliva, it ultimately breaks down, it goes into the biofilm. Even with a non-animate object, a food particle, this cell can talk. This process of talking in between the cells and the process of talking in between cells and an inanimate object is called a quorum sensing. So how will it talk? This quorum sensing is usually done by plenty of micromolecules. Hardly 2 are there. We talked about is the oligopeptides in case of the gram-positive bacteria and this AHL from the gram-negative ones. So through these oligopeptides, the gram-positive bacteria talks, and through this AHL, the gram-negative ones talk. So when a biofilm forms from the day 1 to its day 9th of maturity, so if we can't break that biofilm, this biofilm will ultimately have huge amount of anaerobic, huge amount of gram-negative microorganisms which are very difficult to treat. So it starts with the stage 1, goes to the stage 4. The best way to disrupt a biofilm is in the stage 2. When this van der Waals force is what? The van der Waals forces are very weak. It's a force in between the gram-positive and the gram-negative. It's a force in between the plus sign or the positively charged particles and the negatively charged particles, but it's very weak. So if we can interfere at the stage 2 level, when the van der Waals forces are working, it's easier to break a biofilm. So biofilms can be only treated by breaking the biofilm. You don't have medicines to treat a biofilm. So just remember one thing, that teeth are the only structure in the body which are non-shedding. So if you have a